Hi, this is Dr. Steve Thompson in Image Care, and I wanted to talk to you a little bit today about your All-on-4 teeth. Congratulations for getting your All-on-4 teeth. I know it's been a life changer for you, but I want to talk a little bit today about how to care for your All-on-4 teeth and how to maintain them for the long term. You know, most people kind of mistakenly think is once I get my new teeth, and because they're not real teeth, they don't really require any effort or maintenance. But the reality of it is that's not really true. Our all-on-4 teeth require brushing, just like natural teeth do. There's no need to really use toothpaste because you don't really have teeth in there, real teeth that would benefit from the toothpaste, but brushing with a toothbrush, flossing underneath the all-on-4, getting it underneath there real good and getting the stuff that collects on top out. It's really important. Using a water pick is really good. If you don't have a water pick to use with your all-on-4, I would encourage you to get one because that shoots a blast of water that can get up underneath the false teeth and flush out all of the bacteria, food debris, plaque, etc. And that's really important. The other thing that I recommend is that if you do have all-on-4 teeth, it's very important that you use a rinse of some sort. Two rinses that are very popular for use underneath an all-on-4 are chlorhexidine, which can tend to stain the teeth, and a hydrogen peroxide based mouth rinse. We carry a hydrogen peroxide based mouth rinse called BR rinse here in our office. It's very effective. You can also buy an over-the-counter hydrogen peroxide based rinse called Peroxyl, made by Colgate. The key thing is that you don't want to use the hydrogen peroxide in the brown bottle at home that you use for household related things, because that can have byproducts that are harmful for you, or could, if ingested, could cause some problems. And you want to make sure if you use a food grade hydrogen peroxide, you use a 3% or a 1%, somewhere in that neighborhood. Don't ever use anything stronger than that. So the other thing that's recommended with the all-on-4 is a professional cleaning. Just like you did with your real teeth, you'll want to do this with your all-on-4 teeth. So at least once a year, if not twice a year, we recommend that you come in. We'll remove your all-on-4 teeth, clean underneath them, clean the implants, check everything out, and then put your teeth back in for you. So do that at least once a year. And then the other thing that's really important, a lot of people that lose their teeth have lost their teeth because of a dry mouth. If you still have a dry mouth, even with your all-on-4, you could be more prone to infections around your implants that could cause failure of your teeth. So it's really important, if you're still dealing with a dry mouth, that you remain hydrated. And if just drinking extra water doesn't help, then you may want to take a look at some of the aids that we have, prescription strength and over-the-counter aids that will help keep your mouth nice and moist. So anyway, I hope these tips help, and I hope to, I'm just completely losing my train of thought. You'll have to splice the video there. But I hope these tips help, and looking forward to see you at your next follow-up visit for a nice, healthy, long-lasting all-on-4 set of teeth. Thank you very much.